Hello everyone. My name is Santosh Solanki and my today's daily task topic is a type of adverse event. Indeed, adverse event are unexpected medical occurrence that result in a harm or negative outcomes of patient. These arises medical treatments or condition. Below types of adverse event recognized in details. Uh, Medication detail in events harm caused by the use of drug that assumes of the drug treatment for adverse drug reaction unintended or harmful effect of drug at a normal dosage. For example, allergic reaction to antibiotics tablet or medication error, mistakes in prescribing or dispensing or administrating medication for wrong dose or wrong drug interaction are a negative effect caused by the interaction of two or more drugs, increase in bleeding risk with warfarin or aspirin. uh, Second one is a procedure related adverse event definition. Harm associated with a medical or a surgical procedure. For example, surgical compliance means infection, bleeding, or damage during or after surgery. Anesthesia complication for respiratory depression, hypotension, or allergic reaction to anesthesia. Post procedural issue or delay healing or chronic pain or malformation of implanted devices. Third one is a device related adverse event definition. Issue arising from the use or medical devices malfunction or faulty pacemaker or insulin pumps, improper use or inadequate training leading to improper use of medical equipment. Device associate infections, gather the related bloodstream infection. Or fourth one is a hospital acquired infection. The inspection for infection acquired during hospitalization that were not present or admission. For example, surgical site infection SSI or ventilator associate pneumonia, catheter associate urinary test infections. Fifth one is a diagnostic adverse event harm caused by delay or missed or incorrect diagnosis. For example, delay diagnosis means late identification of cancer, or misdiagnosis means diagnosis of heart attack as acid reflux, or failure to act means ignoring abnormal test result. Or sixth one is a therapeutic adverse event. First of all, harm arising from therapeutic interventions. For example, radiation therapy side effects, skin burns like tissue damage, chemotherapy reaction, some nausea, immunosuppression. Seventh one is a fall of physical injuries. First, fall of physical injuries means harm caused by the patient falls or physical injuries in a healthcare settings. For example, fall leading to fractures or head injuries in a hospital, burns from uh, overhead medical equipment. Blood or yet one is a um, blood product related adverse event. uh, Blood product adverse event means harm caused by the blood transfusion or related procedures. For example, hemolytic reaction due to mismatch blood types, infections, rare infections from contaminated blood, or ninth one is a physiological adverse event. Physiological adverse event, it means the emotional or mental harm caused by the healthcare interventions. For example, PTSD after the traumatic hospital stay, anxiety due to miscommunication or adverse outcome, or 10th one is a patient related adverse event. It is a harm arising from patient specific factors like underlying conditions, behavior. For example, non adherence to prescribed treatment, harm from self medication or alternative treatments. 11th is a environmental or system related adverse event. Definition: harm caused by the failures in a healthcare environment or systems. For example, environmental hazardous means exposure to contaminated water or air in healthcare facilities, staffing efforts, insufficient mm, staffing, leading or insufficient errors, equipment failure, power outages or systemic malfunctions. Uh, Depends upon the type of adverse event, severity based, mild, moderate, severe, or fatal outcomes. Mild means no long term harm may acquire no long term harm may acquire minimal interventions minimal interventions. Thank you.